Hello, my name is Dr. Edward McCloskey. I'm a Chinese medicine doctor, and welcome to Unity Health Podcast. I'm curious about what health means, how illness occurs, and how we heal. We'll be going through a journey exploring the common threads that link many different traditions, therapies, and systems which have something in common. They help to heal people. Let's get started. Dr. Sheng, thank you so much for joining me today.
Sure. Most welcome.
So I just want to start by just giving a brief introduction because actually you, Dr. Sheng, are kind of the a part of the beginning of why I started Chinese medicine. I always get patients asking me how did I start in Chinese medicine and acupuncture, and my story always comes back to this how I met you because my dad passed away from cancer and I started to look into the idea of going into med school. So I was working in pharmaceutical sales. I was a pharmaceutical sales rep and I was studying to write my MCAT. And at the same time I was talking to a lot of doctors as a pharmaceutical rep. But I ended up coming to visit you at that time because my aunt and my uncle are both doctors in the States, and I got to be with you for I think it was three days the first time I came to shadow you, but I had no idea about Chinese medicine. I had no idea about acupuncture, so I got to kind of experience this from a fresh set of eyes and with an open mind, just observe you treating lots of patients. I think we saw around 100 patients together during the time I was there, and I just remember you taking pulses, looking at tongues, running around and making all these herbal formulas, and all these patients just telling me how good they felt and how much you had helped them. So you had told me that Chinese medicine was one of the most complete medical systems that you had come across, and it just really made me very curious about Chinese medicine, and that's what started my journey in Chinese medicine. So I think it's really cool to have you as my first guest, since this is kind of like the beginning of my journey in Chinese medicine started with you.
Well,
So
I'm glad I sort of influenced. I hope I been a positive influence, and you chosen that as a career. So
yeah,
I'm kind of responsible for you to have a prosperous practice and help a lot of people. So
yeah.
I know you're gradually building up your practice, and
Mhm.
you're doing well. You've been out for a few years now, so it is. Um, it is always a challenge for somebody starting because I heard from some other acupuncturists or MD acupuncturists before. The problem is once you finish your training in school, hard to find good mentors in our continuing education. I think it's getting a little easier now because of the internet, because of a lot of educational series on YouTube. Even many of them are even free, and I get to watch many of them in recent years, and that kind of help. And then you try to catch up pieces by pieces, a little bit of information, a little useful information here and there. It doesn't always work. The problem with Chinese medicine is highly personalized. Uh, Western medicine is actually uh, difficult to study, but once you start practicing, it's actually not that difficult. It's a protocol. Everybody take a small field or area, specialty or subspecialty, become pretty routine protocol. Yes, there are challenges, but they don't have to use. I hate to say that they don't have to use a whole lot of head. For
Yeah.
instance, migraine headache. There are several medications to choose from, and if you ask somebody why do you choose drug A but not drug B, well, I'm not sure they know the answer. Just kind of there's some differences. Each drug has different side effects, different pros and cons. But headache, I've treated headache people with Chinese medicine for over 30 years. And there's still many challenging cases. It's not that easy. There are people that don't just don't get better. And again, I'm still learning.
Yeah.
Just within the past 2 years, for instance, migraine headache, um, through post diagnosis, I was able to pick up something and give them herbs. Um, this is in addition to acupuncture. I always give everybody acupuncture for headache, but I give them some herbs through my recent new learning and updated understanding in Chinese medicine.
Hmm.
Uh, the headache miraculously disappeared after many years of suffering. And that's amazing. That is really amazing. That's ancient wisdom. However, that wisdom is difficult to pass on.
Yeah.
You have to keep learning, keep reading, keep talking to people. And it's more like a case by case scenario. It's more like an anecdotal case. It's not a simple protocol. But again, for many chronic conditions we face nowadays, the protocol obviously doesn't work. Otherwise, you and I don't have any room for existence as Chinese medicine practitioners. And the reason we survive and we should survive well or better is because we do provide something that Western medicine does not provide.
Yeah.
Um, that I know that very well after 40 years of practice. Yeah.
Yeah. So I definitely want to come back to this. I don't want to skip out on your introduction before just so people know who you are. So I'll just give a little bit of a, introduction about Dr. Sheng. Dr. Peter Sheng is an internist, a hematologist, and a cancer care specialist. He offers second opinions for cancer and hematology patients. He also delivers integrative care for cancer patients and to treat the side effects from chemotherapy and radiation therapy. Dr. Sheng is a respected and beloved physician. He provides exceptional integrative medical care, combining traditional Chinese medicine with conventional Western medical care. His affiliations and accreditations include volunteer professor of the University of Cincinnati, Department of Internal Medicine and Division of Hematology and Oncology, and he's a teaching faculty member of the Cincinnati VA Hospital in the Hematology and Oncology Division. He has a board of certification in the American Board of Internal Medicine, American Board of Internal Medicine and Oncology. He has a fellowship in hematology and oncology from the University of Cincinnati, and he has a residency in pathology from the University of Cincinnati and internal medicine from the Good Samaritan Hospital in Cincinnati. Dr. Sheng was named one of the best physicians in Cincinnati by his peers and patients in Cincinnati Magazine, and he was voted in 2025 as Cincinnati's best acupuncturist in City Beat magazine. So, Dr. Sheng, you definitely have, so much education and experience in the field of Western and Eastern medicine, right? So, I consider you a mentor of mine, and I feel really lucky to have been able to spend the time I did with you, coming to visit you in Cincinnati and just observe you do your magic. Just I think that's like you said, it's one of those things that with this type of medicine, you really have to have this sort of teacher-student relationship to just observe the what's going on in clinic, right? Because it's not so much based on protocols, like you said, right? It's a very individualized system, and I feel like that's something that is hard sometimes to explain from a modern language. Like what is why is it so personalized? How is it different from Western understanding?
Well, so to answer your question first, I think this is a totally different opposite view from Western medicine. Chinese medicine, from day one, everybody is a different individual. Uh, and the health condition is a dynamic balance and constantly changing. If you go back to the very old Chinese textbook called the Huangdi Neijing, translated as the Yellow Emperor's Inner Classic, a lot of our teaching actually started from there. Or that's the first well put together book. Uh, it presented a dialogue between emperor, yellow emperor, who may be fictionary, fiction, may not be a real person, but anyway, a dialogue between the emperor and his teacher talk about health maintenance, how to promote health, and how to have a longevity. In other words, how to live longer and better life. It's that simple. And then talk about a lot of nature, how our body reflects natural changes. So interestingly, all the series, which are quite philosophical, abstract, and some either, in my opinion, bordering on absurdity by today's understanding. The Chinese medicine theory. In other words, those principles were laid down 2,500 plus years ago, and we still talk about the same thing today. There's nothing new in our teaching.
Mm-hmm.
If you go to the traditional Chinese medicine, that's why they teach you in school. They mention so many things, and we're still repeating it. And then so what I'm saying is, everybody's a different individual
Yeah.
from day one, and so you look at the strengths and the weakness and the imbalances. You try to balance, and then from time to time there may be new problems, new issues, new imbalances that occur, and then you try to treat differently. This is in sharp contrast to Western medicine. I've been in Western medicine too. I'm a Western trained physician first, and then I incorporated Chinese medicine. That was a interesting situation that I kind of practiced both at the same time. It was not easy to blend, but I was fortunate or unique in a way. I've also had a solo practitioner. If I were in a large group, I'm pretty sure my colleagues would not allow me to practice Chinese medicine, acupuncture, herbs. First of all, they don't understand it. Second of all, if I put one patient in an examination room for 40 minutes, they're gonna yell at me. They need a room. You cannot keep anybody in your busy practice 40 minutes. It has to be turnover, okay?
Yeah.
But if I were the boss, I decide what I want to do. So I decided to, at one point, introducing herbal medicine and hand out people herbs.
Yeah.
And that's really more weird to, medical doctors in the Midwest, in Cincinnati, Ohio. Okay,
Yeah.
it's a more I don't want to say backward, but more behind society. It's not like the West Coast, East Coast of the United States, or even Florida or Texas. They're in contact with traditional Chinese medicine on a much bigger scale. There are more practitioners, more people seeking treatments, and more insurance cover too. So, the basic fundamental difference of two medicine, the Western medicine, more and more we talk about protocols, guidelines, pathways. Those are all good. Those are formed by expert consensus, and those cover probably a lot of patients. And those are very good for emergency, severe, serious illnesses. When people are admitted to the hospital, for instance, for pneumonia, for heart attack. These are the list of the things you need to do. And those are the tests you have to order. And then you consult specialists and you form so-called a pathway algorithm. And that's after many, many discussions, and people reach a consensus. They say this is the best way, most efficient way to save lives. No argument. However, I think nowadays Chinese medicine really is for chronic disease. The chronic disease that not easy to get well or get cured. And we're trying to improve the quality of life, try to reduce the use of medication, try to reduce the side effects of medication. And that Western medicine, prescription drug, unfortunately, don't do a very good job. And it's a very complex issue to go into. If we have time, we could dive into it. Because a lot of a condition is a medical terminology coined by so-called experts. I'll give you one example. Fibromyalgia. I'm 72. I've been in medicine for a long time. So I was in neurology as a student. That's 1970, 1973, 4, 5. You're talking about, 50 years ago. Okay. So at that time, the term just began to appear in the literature. There are people kind of aching all over, but when you examine them, you don't find anything. At that time, it's probably fibrositis, myofibrosis, and then somewhere in the 90s, a group of rheumatologists held a conference. We're seeing a lot of people with aching all over. Pain may move around, and then when you press on it, the tender spots, and then when you do the laboratory tests, they're all normal. And then come up with the term fibromyalgia. And again, definition might have changed a little bit over years. Diagnostic criteria might have changed. And the answer is there are two medications approved by FDA. Basically, both decrease the brain's perception of pain, kind of numb you, give you a numb feeling so you don't feel as much pain. And this is the problem. So they're able to use clinical trial, two groups of people, a large number. One group take the medicine, for instance, a medicine called Lyrica or pregabalin. The other group take placebo, and they end up 3 months, 4 months trial period. They came up with a scoring system, ask people your suffering score, your quality of life, and they're able to show that people who took the medicine have had a better quality of life or had less suffering. So the medicine was approved. And so interesting, many, many years ago, after the drug was approved by FDA, I was invited to a local patient support group sponsored by American Rheumatology Association. So this is the fibromyalgia support group. There are about 20-some people, exclusively female, interestingly, in the room. And, asked me to talk about alternative acupuncture or some other thing. What else can you do? And so I went around everybody. They were in a circle and asked, "Did you try Lyrica?" Yeah, everybody's tried Lyrica. Everybody had quit. They all have, initially probably worked, but after a year, didn't work that well. But there are other issues. People have strange neurological symptoms. Some people gained a lot of weight, didn't like it, or um, the benefit doesn't seem to justify long-term use of medication. So long and short of it, in that group that evening, everybody stopped. Okay, so they didn't really get to the bottom line. So what is the root cause of fibromyalgia? What is the real bottom line? What's wrong with those people? You can come up with medication to change their nerve perception. They don't feel as much pain. And on a short-term basis, that's great. Okay. But the long term, the problems still there. And I have my different viewpoint. And I has a different Chinese medicine diagnosis. But I think there's probably poor circulation. We call it blood stagnation or blood stasis. And you really have to apply the pulse in the tongue and try to dive into it to see if there's a yin and a yang imbalance, see if it's a blood stagnation, their energy too strong, your energy too weak, or whether they're too cold or too cold, too hot. So the basic diagnostic principle in traditional Chinese medicine, and you really have to think hard. And I have treated a number of people; they do get better. But the problem for Western medicine is a lot of time I have seen this because people came to me, they came up with a list of diagnoses of fibromyalgia. And it became a questionnaire kind of a based diagnosis. And then people poke around. And I bet probably a lot of my colleagues don't even go by the list of, how many questions you ask, how many tender points out of how many tender points. They just ask around. People say, oh, I hate it all over. Oh, yeah, you have fibromyalgia. Okay, here's the prescription drug. Okay. So it doesn't serve the purpose, serve those population very well. But when I apply the Chinese medicine approach, if their energy is weak, they have blood stagnation. And my take is probably there are pockets of area. There's no adequate blood flow. It's the way I explained to my patient with fibromyalgia, I said, well, people who run marathon, and for the next week, they probably will be aching all over because of a lactic acid accumulation. And because during marathon, the 4 plus some hours running, uh, they didn't get enough oxygen to do the so-called aerobic metabolism. So they will be doing anaerobic metabolism, meaning lactic acid will accumulate, and then there's aching pain, and that will gradually disappear over the next few days. So some people, if they have, for whatever reason, poor circulation, they're probably pockets of area of hypoxia, i.e., not enough blood circulation, and that happened a lot with our blood stagnation, blood stasis. You check those people, their pulse is weak, not a whole lot of jump. You may see purple spotting, on their tongue. You may see pigmentation, skin pigmentation around the ankles. The poor signs of poor circulation, poor venous blood or whatever, venous stasis. And if those people take of the cause, and then what I do, we use the herbs. Well, of course, if the pain localized to one area, for instance, the shoulder trapezius, we use acupuncture, direct the treatment toward that area. But I also add herbs to move the blood. We call it blood movers. And there's a long list of blood movers in Chinese medicine: dangui, 赤芍, 川穹, 桃仁红花. There's a long list of them, and their formulations, 血府逐瘀汤. You add them, you add the qi boosting herbs, and if they're too cold, you try to warm them up. So you put them together with some herbal formulation. You try to improve the blood flow, and they get better. So it's a total different approach, with low variation, of course, of the herbal composition, depending on the pulse, the tongue diagnosis, depending on their main complaints. So rather than just writing a prescription, and I really like to see, and indeed, in at least, I also practice as a medical oncologist, cancer specialist. A lot of drugs are approved by FDA because there's a pressure for FDA to approve some drugs quickly, because there's always shortage of next line of therapy when somebody cancer progress. So sometimes FDA asks the drug company to come up with post-marketing survey or follow-up or study. In other words, we approve the drug in a hurry, but you need to give us more information. The initial clinical trial that allowed the drug approved, maybe 100 patients, maybe 200 patients, maybe several hundred patients, but never large enough population. Okay, but we really need more information, the so-called real world data. I like to know the real world data for fibromyalgia, those who ever get started on Lyrica, a year later, 2 years later, how many people still stay on it? Are they still happy? Or do have some side effect? What's the discontinuation rate? I don't have that kind of data. Perhaps I'm seeing a different population, because only those who are not happy, they didn't get a good result, they come to see me, right? If they're perfectly happy, why would they want to see an acupuncturist? Or why would they want to take Chinese herbs, right? Maybe, so it may not be a fair statement. On the other hand, I really like to see the real world data, rather than just the clinical trial period of 3-4 months. That's
Yeah.
pretty short. This is a chronic condition.
Yeah. Our main job is to try to help people become more self-reliant, right? So they're not
Mm-hmm. Mm-hmm.
dependent on having to take a medication for the rest of their life that's going to give them more side effects that are going to require other medications. But it's difficult because I feel like we are in a system right now, the medical system that you're a part of as well, is hard to know exactly why we do the things we do. Why we're not trying to balance the body? Why are we trying to just treat the symptoms? What do you think is the underlying motive for the medical system to be working the way it's currently working, which is symptom suppression, instead of actually trying to take more time to treat patients and actually look at the root cause and really try to help people become more self-reliant and independent. Why are we not doing that in our modern medical system?
It has something to do with the education. I think um, probably a century ago, if you go back to medical history, recent medical history, again, maybe misquoting quoting some names. So probably before the beginning of the 20th century in the United States, there were a lot of other things too. You know, immigrants from Eastern Europe or Europe or other country, they brought with their folk remedy tradition. You know, there's a homeopathy, there's some other things. But again, some were convinced that we really have a very rigorous system, so-called clinical trials. And again, I don't doubt that a bit. I think there has to be trial, there has to be proof, there has to be experiment, uh, clinical trials, those kind of things. You cannot just go by anecdotal experience somebody just simply because we have done my ancestor used Chinese herb for 2,000 years, so it must be good, right? That's not
Yeah,
good enough. And it's
yeah,
good enough, but not good enough by today's standard. And so a lot of things were thrown out. You cannot be tested by the so-called clinical trial, phase one, phase two, phase three, uh, randomized, double-blind, control trials. Okay, but again, not everything can be tested. A lot of things in Chinese medicine is difficult to test. The basic tenet is not there. In other words, what is qi? You know, we used to qi to we explain to our patient qi, but you cannot measure qi.
yeah,
And patient come back says my chi better. Well, I don't have a chi meter. Score 76 now. Used to be 60. We don't have those kind of things. Very subjective, right? Subjectivity. So, and the other thing is the since our starting point is everybody is a different individual. Then how can you treat? How can you come up with a clinical trial using one, let's say, acupuncture using 5 specified points, or one herbal formulation for everybody, let's say hypertension. Many years ago, probably more than 10 years ago, I reviewed some literature on treating hypertension. This publication in China. They tried several commonly used herbal formulations. These are classic formulation that have been there for many years. And again, nowadays, different physicians, different centers in China may have come up with modern day formulations, different mixture, little variation. But what I want to say is they studied certain formulation and they found that it didn't work terribly well. And the reason it didn't work terribly well is simple, because one formula in Chinese medicine for high blood pressure targets one special group of people. For instance, they say liver yin energy uh, excess or liver fire raising or liver fire rising, meaning the people have a very strong pulse in the left wrist, the left middle position called the left guan position very strong. These people are anxious, bad temper, they may have a bad tempo headache, don't sleep well. So anyway, anyway, the certain formulation to clear the so-called liver fire, to calm the liver, probably work very well if those people also have high blood pressure. On the other hand, you have a different group of people that formulation doesn't work. So what I'm saying is the hypertension in Western medicine, it's relatively simple, and there are 5 different classes: ACE inhibitor, calcium channel blocker, beta blocker, water pill, those kind of things. And you pick one at a time. If it doesn't work, you pick two. Some people I see on all 3 classes, or even plus a little water pill. Um, it probably works a little bit for everybody, but again, there are potential side effects. And I'm not saying it doesn't work, um, but I think the best is really combination of the two. In other words, just one or the other. Uh, but I've definitely seen people who don't believe much in Western medicine, just one alternative. And years later, if you follow them long enough, I know of a gentleman, actually a veteran, who married a girl from Taiwan. That's why I got to know them well. Long and short of after so many years, he ended up with kidney failure on dialysis. He recently passed. Okay, so there's complication if you don't control your blood pressure well, and that's Western medicine. That's statistics. You follow a large group of people with uncontrolled high blood pressure, you know what happened. Okay, so anyway, I think the best is both. And
Yeah.
then I certainly have also seen people with, for instance, the kidney yin energy deficiency. Those people are very cold. When you check the pulse, the third position of the Chun Guanchi, third position is very weak on both sides, especially both Chun or both third positions weak. They're very cold, and those people probably have diminished blood flow to the kidney, and the kidney in turn compensate, send a signal to the heart and the brain, say, "Hey, pump harder, pump more. I need more blood." And those people may have a high blood pressure, and then yes, they need a Western medicine, but you give them some yin energy boosting, especially formulation to boost the kidney yin energy, the blood pressure become much better. Not to say they don't need Western medicine, but the other thing is, if they've been hypertensive for a long time, there's already change of the artery. Some of the changes we may not be able to reverse with a little bit of herbs, a short period of time. They may already have a hardening of the artery. They already have increased resistance, and the body have to pump harder to get the blood out. So the best is probably uh, combination integration. So actually, I'm more of an integration doctor
Yeah.
than just one way or the other. So getting back to what you said, even though we wish we're patient, some of the patient may reduce medication out, always very careful, cautious saying anything. I say, well, continue taking the medication your doctor wants. First of all, I don't want to step on anybody's toes.
Yeah.
And I also don't know their history that well,
Hmm.
because when they came, they may not give a full story, or they may not have a better, complete understanding of their history. So without the medical chart in front of me from Western doctors, prior hospitalization, I'm very careful saying anything, but I will say, if you feel better, you may gradually reduce the
Yeah.
dosage of medication, but also let your doctor know.
Yeah.
I think that's a more cautious and prudent approach. That's integration,
Yeah.
especially come to cancer patient. Uh, I'm never against in a hospital. I still give people chemotherapy. I supervise young doctors' work,
Yeah.
and it's more integration. So another way is to another way to put is I ask the patient, if you don't want to leave any stones unturned, do both. When it
Hmm.
comes to severe, serious cancer diagnosis, which may be life-threatening, so do both. And then, of course, there are other questions, do they contradict this? Again, we just have to watch patient carefully. Whenever in doubt, we hold back. It's unfortunately a lot of doctors don't necessarily have an open mind, so it's still uphill battle even for me.
Yeah.
Try to talk to our patient, and they have a lot of questions. I'm taking this prescription drug, I'm taking this chemo, you give me this herb, you give me the supplement.
Hmm.
How do they interact, right?
Yeah.
Um, so
Yeah, it seems like it's very difficult to actually have an integrative approach to treating patients because you're having to use two different systems and try to make sense of how they interact with one another, right? So if somebody's taking some sort of pharmaceutical medication, it's very difficult to know how the pharmaceutical medication is going to interact with a formula because a formula is a compound of multiple herbs that work together, and sometimes the way that they interact with each other is different as to how they would interact as an herb on its own. And then on top of that, we're dealing with patients that are, most of them have chronic illness. So they're coming to see us already 20, 30 years down the line of some sort of imbalance, right? Talking about this imbalance that the Juan de Neijing speaks of. If you have an imbalance that has already compounded over a large period of time, the damage is usually quite great. And the medication that is being used to treat or to suppress the symptoms of this damage it becomes very difficult to get that person out of that habit. So I think we're kind of in Chinese medicine, and many I think many holistic medicine practitioners are faced with these difficult patients that we're having to treat, right? They're usually
Right.
already quite advanced, and it's a little bit frustrating because we want to be able to help them, but we're kind of fighting an uphill battle, right? They're already quite advanced in their illness. They're taking so many medications that are suppressing the symptoms. I think that's the difficulty with integrative care is it's trying to really understand how these two systems work together and how can we understand it and use it for helping a patient.
Yeah. In an ideal place, and I think there are not too many ideal places, but I think, for instance, I know, give an example, in China, there's some hospital for stroke patient,
Yeah.
stroke rehabilitation. So they will do physical therapy, they will check, control the blood pressure, they will do all the Western medicine
Hmm.
thing. But then they also have acupuncturist, TCM practitioner, Chinese medicine practitioner, maybe some herbs, definitely acupuncture, both together.
Yeah.
So, and some of the hospitals I heard, I don't know how prevalent that is anymore, but at least a number of years ago in China, since one big hospital has Western physicians and traditional Chinese medicine practitioners, they may consult each other. When I went back to Taiwan a number of years ago as a visiting professor at a very big hospital, 3,000 beds, okay, called the Changgen CK Memorial Hospital. Um, that has the Chinese medicine department. There's a Chinese medical residency, students, training, attendings, and then there's Western. And some of the medical students actually uh, spend one extra year to study both without they sacrifice their summer vacations. They just keep studying, and they will eventually be able to get a board certification in both. However, the system, because it's a national health, even though boarded in both, only allowed to practice one. So it's not very rewarding. But again, they do have the understanding. The younger doctors, some of them chose that path. They kind of understand a little bit both sides, and they do consult each other. Um, so, but the Western trained physician have to have an open mind. The TCM doctor is still kind of treated like a second line,
Yeah.
second class citizen, uh, because for TCM practitioners, I'm one of them. When I see somebody in the office, I don't know what a diagnostic workup. I don't know what the blood tests. I'm still using a very primitive, very ancient
Hmm.
way, looking at the patient, taking a history, post-tongue diagnosis, maybe a little facial, maybe a little ear recognition, and start treating.
Yeah.
But the good thing about my practice, probably yours too, most people who came to me in the Midwest have been evaluated extensively by more than one doctor.
Hmm.
And some people say, I have this problem for 5 months. Some people say, I've had this problem for 5 years. I'm not getting better. Some
Yeah.
say, I've seen 10 doctors for this condition.
Yeah.
So that's easy for me because I know it's not likely that I was missed on anything serious.
Yeah.
Um, so that's a good thing about me. But again, if I were on the front line, I would be very I will be very cautious. Am I missing anything? I'll just give you one example. Abdominal pain is probably one of the most challenging conditions because there could be so many things.
What type
And I
of pain?
remember
Sorry,
also medical
what type of pain?
abdominal
Oh,
abdominal
abdominal. Yeah.
pain.
Hmm.
Yeah. So 30 some years ago, I started doing acupuncture, and my mom who was still alive at the time, lived in Seattle, and she, my when my family immigrated to the United States, they settled in Seattle. I went to Ohio, get my training, and then I started practice, never left. So my mom's family doctor, someone also from Taiwan, from a college, medical college, that teaches both Chinese medicine and Western medicine. Uh, so I started doing acupuncture. Uh, there's somebody, journalist wrote about me 30 some years ago, because at that time there are not too many, at least in the Midwest, there are
Hmm.
not too many acupuncturists, not to mention a medical doctor doing acupuncture. But anyway, so this gentleman also learned acupuncture, started doing it. Later, he told me years later, we met, and he said he started doing acupuncture, and somebody came with abdominal pain, and they gave the patient treatment. It turned out the patient had a pancreatic cancer.
Yeah.
Well, without further workup, somebody just said, I have abdominal pain. I said, okay, I'll treat you. But abdominal pain could be so many things, viral gastroenteritis, peptic ulcer, inflammation, gastritis, H. pylori, and the worst, pancreatic cancer.
Hmm.
So, we are very limited in our way to diagnose, and we have to rely on our Western medicine, CAT scan, endoscopy, maybe biopsy, blood tests, and that's how we diagnose pancreatic cancer, right? So you have to keep so many things in mind when you're treating somebody pain. But like I said, most patients in my 30 some year practice, and then acupuncturists and Chinese herbalists, um, very few times I'll miss something serious. But I also also tell patient the first time, I said, well, I treat you a few times. Uh, if you don't feel better, you may need a further workup, because
Yeah.
I'm not in a position when I see somebody and the acupuncturist, I don't order MRI, CAT scan,
Hmm.
blah, blah, blah. It's another interesting thing. If you practice for a long time, you see all kinds of things. I recall two cases, neck pain, cervical neck, okay? And one actually almost 30 years ago. His son is my oldest son's high school classmate. Anyway, also doing acupuncture, people came to me and he had neck pain. I treated him 4 or 5 times acupuncture, uh, not much improvement. He went to have some workup, came back, told me there's a lymphoma in the cervical spine. Kind of unusual location, but lymphoma could be anywhere in the body. Malignant neoplasm of the lymph tissue, lymph node, but that happened to be in the bone. Fortunately, he was treated. We gave him chemotherapy, radiation, and then followed with the medicine called Rituxan. And he called me back a few years ago, maybe 2 years ago, and told me he's still alive, free of cancer. This is at least 25 years later, enjoying life, water sport, water ski, uh, 6 months out of the year in Florida. So it's a happy ending.
Did he have chemo or surgery?
Yeah, chemo radiation. Yeah, and again, of course, the neck pain went away too. And the neck pain in retrospect from lymphoma in the bone. But luckily, if it had been missed for a longer period of time, it may grow to impinge the spinal cord or maybe paraplegia. Okay.
Yeah.
And just and it's interesting, another case. I've been treating this guy with a drummer and neck pain, severe neck pain, and he lost some weight. He also had liver cirrhosis, probably from alcohol. But anyway, I treated neck pain for a number of times. It didn't get much better, maybe a little better or worse. And then one day I saw him not too long ago at the local supermarket, Kroger. Okay. And we're both checking out, self checkout. I saw him. I said, I'm sorry, your face is familiar. I don't remember your name. He said, yeah, no. He said, yeah, I had lymphoma. Somebody treated me. I'm okay now.
Mhm.
Same thing.
Yeah,
Okay. So most of the people with neck pain probably just arthritis, but you never know. There may be a, one in how many? I don't know. One in 1,000, one in 10,000, maybe some other pathology. And then with our capability, we don't know. And we just
yeah,
treat people at neck.
yeah,
But this is important. If you treat people a few times and you ask what kind of workup, nowadays MRI is done very frequently. To go to a neurologist, neurosurgeon, get an MRI, take a look.
yeah. Yeah, I think that's kind of a possible shortcoming of Chinese
Right,
medicine is kind of
right.
recognizing where is outside of our scope of practice. Like what is like a situation where we need to actually step away and let Western medicine take care of it because it's an emergency. It requires maybe surgery. With cancer, that's a subject that I'm really curious about. It's of course, from my dad having had cancer and being shadowing you and seeing so many different people that you treat with cancer. And then in my practice as well, I treat quite a few cancer patients as well. The treatment for cancer, seems like such an aggressive type of treatment, right? It really has a it can really affect the overall body's immune system and has a great consequence that the treatment that Western medicine offers, whether it be surgery or combining that further with chemotherapy and if they decide radiation therapy as well. And I feel like there's a lot of patients that are in the integrative or holistic medicine world, and even practitioners themselves, who believe that the treatment for cancer is dangerous, that treating something with chemotherapy and with especially the chemotherapy, I think is this, this seen as a sort of like toxic substance that can be very harmful. So I'm wondering, I guess, two parts. Why has cancer become such a huge disease in our society? Has it increased over time? And what is your opinion on the current Western treatment of cancer with chemotherapy, for example?
I think this is an area, unfortunately, it's very difficult for a lay person to keep up. I just went to uh, end of May, beginning of June every year in Chicago. There's a large get-together, annual oncology meeting called American Society of Clinical Oncology. In short, we call it ASCO. I just went there, this 5-day meeting, talk about the latest discovery studies, clinical trials, new drugs, blah, blah, blah. I think cancer treatment field is really evolving very quickly. So it depends on what stage. You cannot lump together everybody with cancer diagnosis. The early stage. The early stage is a mistake in my mind not to embark on Western treatment. If surgery can excise it, take it out, and then do whatever you believe in internal medicine, integrative medicine.
Mhm.
If the advanced stage, know your options because there has been a lot of improvement. For instance, stage 4 lung cancer. For many years, we didn't have any good treatment. Yeah, we did give people conventional chemo, significant side effects, not very effective. And now, for the last 10 plus years, there's immunotherapy. And now, stage 4 lung cancer, 20% of them are alive 5 years after diagnosis. It's unheard of. Uh, it will, patients are doing themselves a disservice just by sticking to the old saying, you know, chemotherapy is harmful, hurt my immune system.
Mhm.
I think a more correct statement is a double-edged sword. Know your option. There are, and then, again, chemotherapy. It's a inclusive terms. There are many new drugs under the heading of chemotherapy. They're not a conventional chemotherapy. They're more so-called targeted therapy. We're able to find a gene mutation which drive the cancer cell growth. By blocking it, cancer may be put in remission, not necessarily cured, but maybe controlled for a number of years. So I have quite a few. I still function just as a pure Western trained oncologist in a hospital, in a clinic. People in the 80 years, 80 some years, stage 4, which means widespread metastatic lung cancer, alive for 5 years on just a pill. And
Hmm.
that's unheard of. But that's the result of research. That's the result of making progress. So I think of the integration, and we really play, uh, traditional Chinese medicine practitioner, we play a supportive role.
Yeah.
I think acupuncture is great. Acupuncture help people relax, help them sleep, help treat some of the pain,
Hmm.
digestive symptoms, nausea,
Hmm.
those kind of things. And then one treatment can target several symptoms at the same time. And maybe sores in the mouth, mucositis, peripheral neuropathy. I treat a lot of them. Uh, it's good. Sometimes you using drug alone doesn't achieve that much. On the other hand, as far as the treatment, people are truly getting better, living longer, better quality of life. And that's not achieved. At least I could not do anybody that much good with just herbal medicine.
Yeah.
And I also have people who come to me who give a story. For instance, there's a lady right now in the hospital. It just texted me a few days ago. She ended up in the hospital again. She's lived with a stage 4 colon cancer with a spread inside the abdominal cavity we call peritoneal metastasis for a little over a year. Actually, she was referred to me by a gastroenterologist from the local university, who know that I do alternative integrated medicine, and he also know me, because we work together. And when I put on a different hat, I'm a medical oncologist in the hospital. He knows that I'm crazy, but not crazy enough.
Yeah.
So he sent a patient to me. And the patient said I didn't want to take anything, and um, he had a she had a big operation because of bowel obstruction. They recovered. She still wants something else. She still want chemotherapy. That's okay. It's an incurable situation, but people need to know. And in that case, stage 4 colon cancer, frontline chemotherapy, at least 50% of people respond for close to 1 year. Not necessarily cure, but people need to know, hey, um, there is something available, and we could control toxicity to some extent, adjusting the dosage, adjusting the interval between treatment. That's the art of medicine. That everybody needs that. Having said it's a protocol, but we do vary listening to patient's body, patient's complaint. So I think the best is integration. I think I'm speaking now this moment as a medical oncologist.
Yeah.
I think a lot of lay people don't understand how much cancer medicine has improved just within the last 10 years.
Yeah.
People are truly living longer with different type of cancers and a better quality of life. Not necessarily cure, but this is
Yeah.
unprecedented. I've never seen that before. But again, uh, I'm glad I'm still in practice, and I kind of retire, but I still go back on a part-time basis. I'm still trying to keep up to date on
Yeah.
medical oncology side. So had I quit practice 10 years ago, I would never see what I see today. It's
Yeah.
truly amazing. I mean, it's in front of your eyes.
Yeah.
People live longer and more treatment options. Yeah.
Yeah.
So I think the importance keep an open mind. Um, keep an open mind, know one's option, and like I said, probably the best is some form of integration. But again, not our treatment is good. There are side effects. Just like I said immunotherapy. Not everybody respond to it, and probably 4% people have severe immune system related autoimmune problem as a side effect, because immunotherapy basically unleash one's innate immune system, so let the immune cells attack cancer cells. However, in the process, some our own immune cell can also target attack part of our own system,
Yeah.
be that the skin, the lung, the heart, the liver. the digestive tract. And accordingly, there may be gastritis, diarrhea, pneumonitis, short of breath, heart problem, liver
Yeah.
problem, kidney problem. I've seen all of that. So it's a double-edged sword.
Yeah.
But Western medicine, we have numbers, large data. In other words, how many people, what's the likelihood, and we watch closely. People have the side effect, stop, adjust, manage. Yeah.
Yeah.
So for the listeners, I think important thing really to know your options. On the other
Yeah.
hand, for a lot of chronic condition, I also think that there's not necessarily any hurry to jump into it. I would just cite one example. I've been thinking about this patient. I followed her for almost 2 years. She has a very rare condition called myelofibrosis. That's a bone marrow disorder. Some people start with a very high platelet count. Platelets is a tiny blood cells. Normal number, upper normal limit being 400,000, and she was like 600,000, 1 million. And over time, this evolved into something called a myelofibrosis, meaning there's a lot of scar tissue in the bone marrow. And then the blood forming cells moved out of the bone marrow, went to the spleen, the liver to some extent, and some other inactive bone marrow site. And the spleen become very, very large. And accordingly, there's a pressure symptom on the stomach. She couldn't eat a whole lot. She ate a little bit. She got full. And with time, blood count gradually drops. So she came to see me the end of 2023 because everywhere she went, doctor want to put her on medication. But this is the pretty bad situation. There are medications available, several of them in one class. Some people do respond, very expensive drug, well over $10,000 a month, oral medicine. And it's not terribly effective. Some people do benefit, others don't benefit. And one of the drugs may also cause further anemia. Anyway, she came, she's a Tai Chi teacher, she's 75. And she was grieving because she had just lost her husband. And interestingly, she also mentioned that with the passing of her husband, her symptoms are much worse, her blood count also worse. I believe that emotion can make people better and make people worse. So she got worse, and she came, and I gave her acupuncture. She came from another town about 60 miles away, so she came like every other week. And I gave her herbs. Her main complaint is some, intermittent diarrhea, constipation, more like irritable bowel syndrome. That's her main complaint, the digestive symptom. Of course, she had a large spleen, early satiety, meaning eating a few bites, she got full, but she adjusted her eating habit, multiple smaller meals. And then over time, she went to Ohio State, which is 90 miles away from Cincinnati, got a second opinion, went to see a different hematologist in her town. And I quit practice the end of June. I asked her, I said, how much I help you? Because from time to time, she will give me her blood report.
Mm.
I know she had gradually got more anemic, okay, but still okay. She didn't need a transfusion. And she refused to go on the medication. I told her that I said, eventually you probably want to consider taking the medicine. So she said one thing very interesting. She said, you give me hope.
Mm-hmm.
And that's it. I gave her hope. I didn't give her false hope. I was supported. I talked to her. I did offer her some symptomatic relief, mainly the digestive symptoms like irritable bowel.
Yeah.
She came for acupuncture. I tried to relax her, treat the digestive system, tried to treat the spleen. She did get a little worse over time, but I am someone she could talk to because she said every other doctor, oncologist, hematologist she talked to, they said the same thing. Take the medicine, take the medicine.
Yeah.
Okay. But sometimes you just talk to people and they feel the support, they feel the bonding,
Yeah.
and they feel good. and that's why she would drive 60 miles every other week
Yeah.
through winter, weather, and she felt good.
Yeah.
So that's important. That kind of support, that kind of a rapport, that kind of relationship, it's important in healing. And eventually, she probably have to make a critical decision whether to go on a medicine or not. But then that medicine is not curative either. I know that medicine very well. It's a rare disease, but at least there's some treatment option.
Yeah.
Um,
Yeah, you
so
touch on a really important point, which is the aspect of emotional health. And the diagnosis sometimes can cause a lot of fear for patients, and we know that fear severely inhibits the immune system response, right? So
yes,
I think that's a huge part of it is as a acupuncturist or a medical doctor, whatever profession you are in the medical field, is really understanding our role to treat them through the lens of our profession, but fundamentally to give that person, like you said, hope, not false hope, but understand that the words that we use and how we communicate with them is directly affecting their immune system. And we don't fully understand through the Western view how emotions affect health.
so that's a complex issue to get into.
Yeah,
But we have a way to diagnose too and then treat accordingly. But acupuncture is very good for relaxation and sedation
yeah,
and insomnia. So that's why everybody come to me for acupuncture. I try to relax them, try to sedate them,
yeah,
among other things I treat. Yeah.
yeah. Okay, Dr. Sheng, thank you so much for your time. I just want to just take a moment here to say that the information provided in this podcast is for educational and informational purposes only, and is not intended as medical advice. The content reflects the personal opinions and experience of the host and guests and is not suitable for professional medical diagnosis, treatment, or advice. Always seek the guidance of a qualified healthcare provider with any questions you may have regarding a medical condition or before starting any new health or wellness program. Never disregard medical professional advice or delay seeking it because of something you heard on this podcast. Dr. Sheng, thank you so much for your time. I really appreciate it.
Well, thank you for
Is
having me,
is there
Garrett.
is there anywhere where people can find you online?
Oh, just petershen.com. They
petersheng.com?
just petershen.com. They can contact me through email.
Okay, I know you're retired now,
I
but
still do telemedicine.
you still do telemedicine?
Yeah,
Great.
yeah,
Okay.
yes.
Okay,
Okay.
Dr.
Thank
Sheng,
you.
thank you. Take care.
Okay, take care. Bye bye.
Bye-bye. Thank you so much for listening to Unity Health Podcast. If you have any questions, comments, or suggestions on any guests who you think I should interview, please feel free to leave it in the comment section below. See you next time.